very briefly by doing a self-introduction, a very quick self-introduction. My name is Nightingale Wakigera, and I am currently in Kenya. I was also born and raised in Kenya, and I work with an organization called ACOPER that focuses on health and environment. And I'm very, very glad to be the one moderating this event. And I want to say a very big thank you to everyone behind the scenes that have made this event possible. I will start with a quick disclaimer. I'm on the road just for a minute, but I will be settled in a little bit. So if I look like I'm jumping up and down or anything like that, it's just because I'm in a vehicle. But we're all good. So we will have most of the interactions will happen in the English language, but we will also have some translations happening. And so, and one of the things I would like to ask us is, as we move into the presentations, just think about the questions you might have, the suggestions you might have, and feel free to put them on chat or in the space that's made available for that. So once again, most welcome to this event. It's a webinar series, and we are focusing on building a climate resilient and environmentally sustainable health facilities in Africa. We have, just like is posted, we have some objectives, and they're listed up there. Just real quick, it's for us to understand the principles and benefits of a climate resilient and sustainable health system or health systems, identifying practical solutions and innovations, as well as looking at how to strengthen the capacity of health professionals and stakeholders specific to Africa, and even looking beyond, because we are one global village. So the webinar series, you can see on the screen, we have the topics. So today we're focusing on the introduction to climate resilience in health systems and the role of healthcare facilities. And then in November, on the 5th, we have our second webinar, and it'll be renewable energy and energy efficiency in health facilities. December 3rd, we look at water and waste management. January 7th, that's the fourth webinar, innovations in the design and construction of healthcare facilities. And in February, on the 4th, our fifth webinar, we will be looking at empowering the health workforce and other relevant stakeholders. So our learning objectives for today, we explain how sustainable healthcare facilities contribute to climate resilient health systems. Identify key sources of greenhouse gas emissions in the health sector. Apply WHO and other relevant frameworks, toolkits, and guidance to plan sustainable healthcare facility improvements. Recognize opportunities to integrate health system priorities into national climate and adaptation strategies, policies, and budgets. And then assess potential long-term cost savings and health benefits from climate resilient healthcare investments. And so you can see our very special guests that have offered to speak on these important topics. And we have Charles Akatobi, who is the Senior Technical Officer, Africa CDC, Gerard Georges, and I want to request for forgiveness ahead of time, because I may pronounce the names a little bit off from how you pronounce them, but Gerard is Director of Architecture in Build Health International. And then we have Ruto Abanga, who's the co-chair, Climate Resilient and Sustainable Health Health Systems Global. And then last but not least, Aziza Rangunwala, Africa Coordinator, Global Green Healthy Hospitals Program and Healthcare Without Harm. And without further ado, I'm going to do a quick introduction of our very first speaker, that is Dr. Charles. And so Charles, so I'm looking because it close Charles's bio. But I just want to say just real quick that I will invite Charles to just come in and speak, and then I'll introduce you a little after the fact, if that's okay. I just closed the slide. But Charles, if you can please come on board, and thank you so much for honoring us.
Thank you very much, Wakigera, for moderating this section. So I'm going to quickly take you through my section on this very interesting topic. Confirm that you can see my slide, please.
Yes, we can see your slides. We can see your camera.
Can see my camera?
Yeah, I can see you. It's all black.
I don't know why.
But I can see, yeah. Thank
Can you
you.
see me now?
Yes, thanks.
Yes.
Okay, thank you. So, colleagues, good evening. I think this is one of the first series in a series of webinars that will be looking at how we can build climate resilient and environmentally sustainable health facilities globally, but with some narrow focus in Africa from my own perspective, because some of the experiences I'll be sharing will be akin to Africa, where some of the greatest impact of climate change is being felt. So as introduced, I'm Charles Akatobi Michael, and I work with Africa CDC. I think for all of us that are joining this webinar this evening, one thing is very clear, that climate change presents one of the greatest public health threats in our time. Currently, it's actually redefining the factors that influence both social and environmental determinants of health. What we used to know initially as epidemiological drivers of health and disease is significantly changing in terms of geospatial distribution and scope. And it's also increasing the frequency and severity of extreme weather and disease pattern. And that we're seeing very much in our continent, across many nations in our region. Now, Africa is unique in the context of climate change and health because we contribute the least in terms of greenhouse gas emission that is driving climate change, about less than 5% of the overall contributions. But yet we remain the most vulnerable region. Our vulnerability is influenced by the fact that we are significantly exposed to the risks. Being in the tropics, our weather, our temperature ordinarily enhances the proliferation of disease-causing organisms. But much more importantly, with the impact of climate change, this risk is exacerbated. Also, in addition to that, we are challenged by weak socioeconomic conditions. Many of our populations are the low poverty quartile, and a lot of them are, and that increases their vulnerability. But beyond that, both our health system and populations have very low adaptive capacities to climate change. So you won't be surprised why Africa bears the greatest burden of climate change. But even within the region, the impact is disproportionate, with the poorest and most vulnerable communities having the greatest impact. And suffice to note that the people who suffer most consequences are also the people most vulnerable for most other socioeconomic impacts, including poverty and other social determinants of well-being. Because we're looking at both climate resilience and environmental sustainability, I decided to bring this context of how environmental risk factors are aggravating the burden of diseases, but much more importantly, their contribution to global mortality. As you can see here, 23% of all global deaths are linked to the environment. And this is, you're looking at about 12.6 million deaths per annum. So you can just imagine if the environment alone contributes this significant quantum of mortalities, what the situation will be, especially in a region that is most vulnerable. And that is made clear in terms of Africa's contribution. With our about 1 billion population, environmentally linked threats are causing about 2.2 million deaths. We're the third most vulnerable regions in terms of mortalities linked to the environment. But suffice to note that if you see on the right, this other chart, it tries to disaggregate these causes of mortalities. And you will see that whereas in most of the developed climes, you can have non-communicable diseases as key drivers of environmentally linked mortalities. In our own climate, we still have infectious diseases significantly driving that. And this is why the impact of climate change will definitely, in the health system, will be most felt in Africa than it will in most parts of the world. So having noted that, it becomes inherent to understand the fact that health facilities are critical to adaptation and mitigation measures with respect to creating climate resilience. This is because health facilities are the front line of both resilience and sustainable development goals, because we need health facilities to remain functional during climate shocks. Otherwise, people who are affected will not even receive the emergency health needs that is critical for their survival. Also, we need health facilities for sustainable climate resilience and adaptation. We need them to be strengthened to be able to sustain climate resilience and adaptation, both for populations and for communities. And much more importantly, this is actually aligned with the universal health coverage requirement and the sustainable development goal. If we must achieve the health indicators for the SDGs, the health facilities need to be climate resilient and environmentally sustainable. But beyond that, these needs, it's also worthy to note that climate change also contributes to greenhouse gas emissions, almost about 5% of the global contribution. And so it's also akin that we must really look at health facilities, both in terms of adaptation and resilience, as well as mitigation with respect to the greenhouse gases that they contribute. So we have a lot of framework that have provided opportunity for building resilience. We have the WHO new guidance on safe, climate resilient and environmentally sustainable healthcare facilities, but we also do have the African CDC climate change and strategic framework, which was recently launched, and also the wider African Union climate change and resilient development strategy, 2022 to 2032. Now, I think for the purposes of the broad scope of our participants, it's necessary to understand the terminologies that are being used in our topics. When we say climate resilient in health facilities, what are we talking about? We're talking about the ability of a health facility to anticipate, respond, cope with, recover from, and adapt to climate shocks and stresses. And when we talk of environmental sustainability, we're looking at minimizing resource use in terms of water, energy, materials, reducing pollution, waste, harmful emissions, while sustaining procurement. So I have highlighted the 4 critical fundamental requirements that the WHO has provided as essential in building health resilient and climate and environmentally sustainable health facilities. And 4 of them are, of course, health workforce. Of course, we do know that human beings are the ones that they're the life wire of any organizations. They're the ones who use AI, they're the ones who use computer, and they're the ones who use health resources. So they must be trained, they must be capacitated, they must have a safe working environment, they must be adequate and appropriately with appropriate expertise. And then, of course, they need to have the necessary protocols to be able to make their health facility resilient and sustainable. Then, of course, another key thing is one of the things that are lifesavers. Nobody can survive without water. And so, but the quality of water is important, and especially in a health facility where water is used for many services, it is important that WASH is a critical concern, and healthcare waste management, because healthcare waste management can be a very great risk factor, especially if you have flooding now, for example, and there's wash off health waste. Those are usually more dangerous than conventional waste that we generate in our home. Then you talk of sustainable energy services. Of course, we do need energy to drive health activities. Many of the health facilities in Africa do not operate optimally because of the suboptimal energy supplies, and many of them do not operate in climate-friendly and green energy power sources. And so they are suboptimal in terms of services and also great contributors to the threats of climate change, and that needs to be factored in. We cannot talk about all of this without talking of the enablers of what we do currently in our world today: infrastructures, technologies, and products. And here you're looking at the design, refitting to suit purposes, selecting resilient materials, sustainable procurement, and even supply chain networks, because all of these have implication for a health facility's resilience as well as its sustainability. Recall in my topic, I had looked at the energy paradigm. So I will narrow down of all these 4 things that I've highlighted. Energy is critical, especially from our section of the country. And this is because 5 to 8% of global energy consumption worldwide is by the health sector. And so it means that if the health sector was a country, it is actually consuming a great quantum of energy. And this is just what it is consuming, but this is not what it requires. So what it means is that beyond this, and like I've talked about the suboptimal supply in many of our settings. So it means that if we are to supply adequately to all regions, this consumption level will be significantly higher than this. Now, healthcare emissions also 10th largest emitters of green gas emissions globally. And so you can see the quantum. So if you can actually take care of healthcare energy supply in terms of green energy sources, then you are able to reduce significantly the contributions from the healthcare. Of course, would have actually reduced climate change threats. In sub-Saharan Africa, for example, over 100,000 health facilities lack reliable electricity. And you can imagine the quality of services that this kind of health facilities will provide. And it's also been noted that 109 distinct infectious diseases are linked to climate change. Air pollution deaths, we've seen the numbers rising in recent time, with about over 7 million people annually dying from that. So what is the impact of climate change on disease burden? We looked at the energy nexus, and we thought of different scenarios. The first scenario is where energy decisions ignore health. We look at also health decisions ignoring energy, and we also looked at climate decisions ignoring both energy and health. And you see that in all of these scenarios, what comes to fore is that for as long as we continue to operate under a siloed approach, there's going to be significant persistence of climate change threats with increasing disposition. And of course, those impacts are going to be more highlighted. It's good to note that in the for EU alone, coal still provides 75% of SO2 emissions, which are contributing to the greenhouse gases and of course to climate change. And we've seen this also in different scenarios. If you look at health decisions ignoring energy, you see that a lot of vaccines are wasted when we have unreliable electricity supply, because those vaccines become non-viable. And these are just to highlight the energy impacts of at that nexus. So what we see as common pattern for siloed approaches is missed co-benefit opportunities. Because if we co-plan with the energy sector, we are both able to optimize opportunities. Now, unintended negative consequences, not because the energy sector wants to cause these gaps, nor does the health sector want to continue to emit greenhouse gases, but because they are both not having this context of a One Health approach to addressing resilience and sustainability. Inefficient resource allocation, of course, we see each sector tend to get resources, and you see the energy sector saying that they want to support health systems, and they build infrastructure without taking into cognizance the health could benefit of using green energy. And at the long run, we might spend more on the same issue. Then, of course, reactive rather than preventive approaches. Because of this, when the consequences of these siloed decisions begin to impact on our health system, you find us always reacting rather than being proactive to prevent. So I've just brought some case studies that try to look at this nexus, and I took Nigeria, for example, looking at losses that are associated whether with cold chain at health facilities or with heat stress as a result of power outage, especially during the heat period when many people use air conditioners or even other facilities they use to ameliorate the air situation. And then we also look at flood impact on health facility. Recently, in the northeastern part of Nigeria, we had flooding significantly undermining the services of a region of a national teaching hospital with millions of dollars worth of equipment lost in that scenario. And you can understand how that impact will be with respect to sustainability of health services. So what should we do? We should adopt a One Health approach to create synergies. One Health approach looks at a multi-sectorial design and systematic thinking in terms of delivering services, whether at human, animal, or environmental interface. And this approach enables the health sector and the energy sector to have in-depth understanding of what the bilateral needs will be able to optimize functionality. It is in the context of this, and speaking to the Africa CDC strategic framework, that I've highlighted some of the key strategic interventions that we have identified as critical to building resilient health systems and communities, but much more also strengthening health facilities. And all of these are revolved around research, innovation, and data to know what is the impact, what we currently have. Capacity building, of course, I'm happy that that is also captured adequately in the series. Risk communication and community engagement. Risk communication is not only to the local communities, but even to the health workforce community. There is need to have this dialogue, and I'm sure many of them are joining this discussion this evening. Governance and leadership. There is need for critical multi-sectorial decision-making process that allows the highest leaderships at the different sectors to understand this context of climate change, knowing that no one sector can address the consequences alone. Of course, we're looking at innovative financing because finance is a critical gap. So what will this intervention across these 6 pillars do? They'll be able to enhance policy guidelines and regulations that include building codes, environmental standards adherence in health facility construction, situating health facilities in a way that they are environmentally sustainable but climate resilient. When you go and situate a health facility in a floodplain, what do you expect during flood, of course? Financing and investment. There will be a synergistic approach to capital cost, operational cost savings, and then, of course, the savings can be returned into the system to enhance efficiency. Partnership across sectors, but much more importantly, we need to monitor and continually evaluate what we do to see if they are context specific and if they are fit for purpose. And also, we need to harness local solutions, innovate around them, and make them more environmentally friendly. I've highlighted some challenges and barriers to building climate resilient and environmentally sustainable health facilities, one of which is cost and funding constraints. One, in this respect, you're looking at costs and funding constraints as a result of wastage, siloed planning, and also, of course, inadequacy. And we need to look at this holistically. Most times people look at cost and funding constraints from the perspective of inadequacy, but it is good to contextualize them along those three themes I've highlighted. Wastages as a result of siloed planning, inadequacy, and of course, poor budget implementation. Technical capacities, human resources, this can never be overemphasized because humans are the life wire of any organization. The viability of any organization is as good as its human resources. And so if you don't train them, you don't blame them. And that is why this training is critically important. These webinar series are important for us to discuss these issues. What of existing infrastructure that is hard to retrofit? What do we do about them? Those are key barriers, and sometimes, and that is why from the planning stage, it's good for us to take climate issues, environmental sustainability issues into context in terms of environment and social dynamics. Regulatory and policy gaps, supply chain and maintenance issues, uncertainty about climate risk projections, but then we need to also start harnessing meteorological information, superimposing them on epidemiological information so that we can have a very intelligent early warning system and a very intelligent and climate smart surveillance system. What of equity concerns? Sometimes we do not take appropriate action because the most vulnerable populations are the fringes of our cities. And so we do not take cognizance of the impact and the risks that they are exposed to, and of course, the challenges that they have. We need to become more intentional in looking at the left population, the populations that need to be protected, the elderly, women, children, who are sometimes at the greatest mercy of climate change issues. So climate actions must factor those sense of equity in terms of distribution of its resources. I will not end my talk this evening without making some suggestions in terms of what we should do. One of these we suggest and we're supporting countries to do under the African CDC is the conduct of vulnerability and capacity assessment, both at health facility and at the larger country level. At the larger country level, we're talking of vulnerability and adaptation assessment. At the health facility level, we're also talking of vulnerability and capacity assessment. We're also talking of developing and updating policies and standards for resilient and sustainable health infrastructures, prioritize interventions, look at what are the low-hanging fruits versus what are the long-term investments. Let's not say, no, nothing can be done because we cannot retrofit health facilities. No, but what can we do in terms of reducing emissions? What can we do in terms of what is available? Planting more trees around the health facilities to make them more eco-friendly. What can we do in terms of replacing diesel-driven generators or fossil fuel-driven generators with solar panels and other green energy sources? So those are some things we can think of. We might not be able to change the position of the building, we might not be able to rebuild the building or retrofit it, but we can also do some adaptation that can enhance resilience and sustainability. Let's continue to push together through a One Health approach in budgeting and also in funding, in sourcing for fund, capacity building and workforce training. This series is going to contribute to that, but I know that my colleagues are going to also speak to all of those different ones we've done previously. And at Africa CDC, I think we're also supporting those, both physical and virtual. Then engaging communities, whatever we do, as long as the communities are not factored, we've not done anything. So no matter what policies we make at the highest level, be it global, regional, continental, national, subnational, if the community recipients, the last mile, are not benefiting from those policies and decisions, then they are not really worth the onion. So what are some of the benefits and co-benefits that we accrue from those roadmap of actions? One of them is improved continuity of care, even in times of emergencies, reduce operational costs as a result of reduction in waste of energy, water, and even proper management of hospital waste. Health benefits from reduced pollution, better hygiene, better health facility environment for recovery of patients and for even both the health workers, reduce greenhouse gas emissions and environmental footprint, increase public and donor confidence, but much importantly, we will all be aligned in our desire to achieve the sustainable development goals and equity. Let me just conclude with this, summary of key messages. Dual need for resilience and sustainability is critical. We could build resilience, but we might not build sustainability. So both contexts must be factored in all of our policy framing and health programming. It is both feasible and they are both necessary. Early incremental actions are valuable. We should look at the big picture, but start with the small fragments or segments. Let's not wait until we have everything on ground. We can segment our approach based on resources in terms of human and financial resources. Importance of enabling environment and partnership cannot be overemphasized. That is why in the new public health order of the African Union that drive what we do at Africa CDC, one of the critical pillar 4, is respectful action-oriented partnership, because no one can be can do it alone. No one sector, no one country. We must all unite to be able to optimize the environment that heaven has blessed us with. Call to action for facility managers, policymakers, and funders to think from this perspective, and I think we'll be able to do much better. So I'll wrap up here so that I can also give space for my co-facilitators to also give us their context. Thank you for your attention, and wishing us a very fruitful deliberation. Thank you. And back to you, moderator.
Wow, thank you so much, Dr. Akatobi. I will take a shot at that. And I just want to say, the One Health approach, that's one of my biggest takeaways. But I do want to do a quick disclaimer and say that I did not introduce you officially. And so I want to now put the hat on your head now that you're done doing that amazing presentation. And I just want to let everybody know, in case you don't know already, that Dr. Charles Akatobi, working with Africa CDC, is an epidemiologist, immunization expert. He calls himself a climate change and health enthusiast. I want to add, and also expert. And he has done a lot of work that it would be hard for me to say all of it, but he has over 15 years of experience in the progressive public health leadership space, and a lot in immunization, disease surveillance, One Health, which is why you speak so strongly about the One Health space. So I urge all of you to go to LinkedIn especially, and you're going to see most of what some of what Dr. Charles Akatobi has done. But just to say a big thank you to you. And I think we will say more on what Dr. Akatobi you talked about. But at least for now, I think for me, like I said, the big takeaway is we need to really center, well, I said One Health as my takeaway, and also making sure that the leadership within our nations, the policymakers, are very well aware and included in this process. So like we say over here, where I come from in Kenya, asante sana, and hongera. So I will now move on to our second presenter, Dr. Rudolph Abanga, who is a health development and sustainability professional with 20 years of experience leading transdisciplinary collaboration in Ghana and internationally. He served on the Global Steering Council of the People's Health Movement, PHM, from 2012 to 2014, and he's the current co-chair of the Climate Resilient and Sustainable Health Systems Technical Working Group with Health Systems Global. And in 2024, he was appointed as an adjunct research fellow, climate change and health at the West African Center for Sustainable Transformational Development at the SDD, University of Business and Integrated Development Studies. And in the more recent years, he has been involved in international advocacy on climate change and health, contributing to the WHO Global Research Agenda on climate and health. It's REACH as an acronym, consultations and the validation and review of the Africa CDC Climate Change and Health Strategic Framework 2025. And Dr. Rudolph is committed to advancing inclusive, equitable, and evidence-based strategies for climate resilience health systems across Africa and globally. So, Dr. Rudolph, you're welcome. Karibu sana.
Thank you. And thank you, Charles. I think that Charles has laid the foundation for my presentation, and I think that maybe I would attempt to kind of practicalize what he just said, but that was a very insightful one. So first, okay, this session objectives are already explained, and then I'll move to my outline. I would like to make a case on why we should have climate resilient health systems, or low carbon health systems, or environmental sustainability as others will call it. And then I would like to touch on some of the source of greenhouse emissions in health systems, and then also try to touch a bit on the international framework and tools. I am sure other speakers would also come on with more practical and then ways of implementing these tools. And then again, from my perspective, I also try to look at some of the facilitators and barriers, and then the opportunities that exist to institutionalize or mainstream climate change or climate resilient and environmental sustainable health systems. Now, Charles has already spoken a lot about this, but I think that it's very clear. According to the WHO, we're going to witness 250,000 additional deaths annually between 20 and 30 due to climate change. And then most importantly, we are going to get 100 million people driven back to extreme poverty by 2030, according to the World Bank. And most of these will be attributable to health or related to health. And then just like Charles said, health service disruptions would definitely undermine universal health coverage. So I hold the view that we cannot actually attain universal health coverage without working on climate resilient and environmental sustainable health systems. And then again, there's a big cost, estimated 200 billion loss directly linked to health and healthcare, according to the World Economic Forum. And then most importantly, the health sector accounts for 5% of global greenhouse gas annually. This brings the compelling case why we don't just have to build resilience, but we also have to pursue environmental sustainability. I mean, health systems and health facilities. Now, these are just key examples, just emphasizing on what Charles have said. Obviously, to my left, that is a beautiful ward. It's flooded, equipment have been destroyed. And then again, you can see just after that, you also find that there's something like a delivery room that I think a storm or something has torn it up. And you can imagine what will happen if you have a client there that is in labor. And then you can see myself there. I traveled to a community and it's just rained, small rain. The whole place was flooded. And you can imagine if there's a critical case, what was going to happen. And then you can see this beautiful nest on top. I think they were doing a routine chemotherapy or prophylaxis for malaria. You can see that the background is all flooded. So what are we going to see? So it means that they are never going to come back until the rains have subsided. And these children that are going to miss these important vaccines and other interventions that we have, what is going to happen to them? So these are the questions that we need to ask ourselves. And then you can see to my extreme right, that was a medical doctor from Ghana. She went to work. The next day she was coming home, and then unfortunately she passed on due to heavy flooding in Accra. And you all know how much it costs to train a medical doctor. And then again, now my favorite slide, it's this beautiful health facility away from the capital. That so much investment had been put into Bolt. But unfortunately, when it rains, nobody can walk into that health facility, and then nobody can come out of that health facility. All these kind of gives us an idea what climate resilience means. And I want to emphasize what Charles said. There are things we can do now. We need money to do it, but there are things we can do now. For example, the siting of this health facility with appropriate community deliberation and partnerships and the rest, we could have sited it, or those who constructed it could have sited it at the most appropriate place, and everybody will be happy. Then again, just to emphasize on the nexus again, I think that on my left, it's a health facility. I took it from the WHO site in Madagascar, I think so. And then you can see that a storm has finished the roof. The roof is gone. You can imagine what has happened to the equipment. So those that come, those that are affected directly by this storm, or people that suddenly fall ill, how are they going to access critical healthcare at the time they need it? Also emphasizing why health systems or health facilities must first be climate resilient to be able to deal with the problems associated with a changing or rapidly changing climate. Energy, you can already see this is an electricity pole. Wildfire has devastated it. You can imagine all the health facilities on this line, what happens to their vaccines, and then refrigeration dependent medicines, immunizations, and other things. So that tells you the story, and that builds the case for climate resilient health systems, or climate resilient and environmentally sustainable health systems. Now, Charles has already defined this, so I don't need to stress on it. We have already got a very clear definition of what a climate resilient and an environmental sustainable health facility is. And then, so I will just skip this slide. Now, specifically to the health sector, I want to touch what are the sources of all the waste and whatever that comes from there, or greenhouse emissions. Clearly from the WHO, we have three scopes. Scope 1 is something that we can directly control. And then this comes from the workforce, whatever we are doing, how do we travel? And then we can do the 3 R's. We can reduce, reuse, or recycle to be able to control that. And then we can also reduce unnecessary travel, anesthetic products. We can choose to use environmentally friendly ones. And then scope 2, again, it's something that we don't have too much direct control over, but we can deal with it. And then that is indirect, that is energy, of course. Water, heating and cooling, we can do that. And then electricity, how do we use our electricity? So these are things that we can put in place interventions, which we don't need to do heavy investments now to be able to get that, but we can take action towards that. Then scope 3, which is the largest, also still has to do with things around the health workforce, what we do, how do we travel, and how we do things, and then waste disposal, and then energy use. But most importantly, I want to kind of highlight green procurement. What equipments do we buy? What kind of supplies do we buy? And how do we buy them? This is very important in scope 3, the supply chain. So we must begin to look at green supply chains. And this is something we can do. We already have the money, health facilities are buying. It's just a matter of making the right choices to ensure that we are not releasing so many things or greenhouse gases, or polluting the very F we want to protect, and the very people that we are working for. Now, I want to give you very clear examples. This is clear on my left, this health facility, that's how they dispose their waste. You can see what they are doing to the environment. And then just down that, it also tells you how it's been disposed in some rural parts, and it tells you the story. And then this beautiful kente dress from Ghana. You can see the yellow plastic there. The fellow has gone to the hospital and then he has had medicines and it's in a polythene. Can't we do without this? These are things that we can actually do without and we begin to become green or environmentally sustainable. And then one day I was taking a walk and I came across the same polythene. If you can see it from a health facility. And I assume that how many of these do we get into the environment every day? And then what is the cost of this to the environment? Now, I would like to focus a bit on this beautiful health facility. You can see standard. It's the pride of Ghana. We call it the University of Ghana Medical Center. Everybody talks about it, but you can already see from the design. What do we have? We are having so many glazes. What does it mean? It means that we have to use a lot of energy. So what can we do for this? So first, we could look at, even though it's already built, there's a high demand for energy, but we can also do little things that don't cost so much to ensure that we are a bit green or we are environmentally sustainable, apart from being climate resilient. You can see this, my friend here, I got it from Getty Images. We can begin to use energy-saving bulbs and not the LED ones, and not the ordinary ones. We can begin to use them, or we can substantially reduce energy consumption. And then we also have photo cells here that can be used to control or only use light when we want it. You can actually walk into a health facility and you see that all the outside lights are on when there's a lot of sunlight. And then I can tell you that with the use of these, we can reduce consumption drastically. And obviously, we can always green our health facilities. And we can also decide to choose what material we use in the design. Are we going to use glazes when the temperature is always above 30 degrees Celsius, or we can just use simple louvers? We can use, we can also green to ensure environmental sustainability. Now, there are a number of frameworks and tools that I have come across, obviously led by the WHO, quite recently African CDC. And to my left, you have the PAHO, WHO PAHO. They have the Hospital Safety Index, which is meant for climate proofing. So it basically builds climate resilience to ensure that when there are issues or when there's an extreme climate event, the health facility survives it to be able to render the critical services. Now, below it, they have improved it, and then they have what we call the Smart Hospitals Toolkit, and this takes into consideration both environmental proofing, and then again, it also takes into consideration green and smart operations to ensure that there's environmental, both climate resilience and environmental sustainability. Charles has already touched a lot on the climate change and health framework, the strategic framework for African Union, so I don't even need to talk about it. Then now we also have the World Bank, they call the diagnostic. I think it's been used in Madagascar, and then the WHO supported them to be sure that they can build climate smart healthcare facilities. Then we also have the Global Green and Healthy Hospitals Initiative. They have an elaborate tool that they have used all along, and I'm sure Aziza would touch on that, so I won't even go around it, but they work around 10 goals that you can clearly see on the screen. And then the WHO already has a number of frameworks, and then again, the first framework for building climate resilient health systems, it talks about building resilience, environmental sustainability or low carbon around the 6 building blocks of health systems, which I think most of us know: leadership, health workforce, health information, essential medical products, service delivery, and then financing. And they do have a tool for fairly assessing whether our health systems are good or they are climate resilient and environmentally sustainable. Now, Charles has already talked about this, about climate resilient and then sustainable health facilities. This is the WHO framework that talks about we working on the health workforce, water and sanitation, energy and infrastructure. Charles has spoken about it. I'm not going to touch it, but I want to emphasize that it's accompanied by a checklist that you can use to assess your health facilities. In fact, you first will be able to identify what kind of exposures that they are likely to see, and you can actually also assess the vulnerability of these health facilities. And then again, you can also assess the impact, and it provides a planning tool for you to plan on how you can build climate resilience and environmental sustainability. Now, over the years, working in this area, what are some of the key barriers to mainstreaming climate action? First, there are policy inconsistencies and limited stakeholder understanding of the whole nexus. People don't really try to understand that, well, health is the face of climate change. And then, so people don't understand it. So there's that work in silos. And then again, there's limited participation of Ministry of Health in country processes. So once the Minister of Environment is responsible for all this and the Minister of Health is not involved or health actors are not involved, then you have a problem to deal with and then you just leave it to go. Then there's insufficient coordination. Ministries are not coordinating. Even at the local level, they are not coordinating. Everybody's working in silos. So this brings in the need to sufficiently coordinate these things. And then policy incentives, what we call tech mainstreaming. And then fine, you can know that you all know that health facilities or health systems are heavily regulated. They work based on policies, standardized programs, standardized protocols. And then once we are not able to mainstream climate considerations into these policies, protocols, of health systems, then we risk that they are not implementing or they will not take it seriously. So, and there will not be accountability for it. And then cost is already a big factor. And as I have told you, it's not everything that is so expensive. We can do a lot more to be able to do these things. And of course, primary healthcare facilities or health facilities are always resource constrained in our part of the world. And then largely, most of the time, all these approaches are top-down. We do not have bottom-up approaches, and then people just don't appreciate things like that. So we need to harness the community. We need to build bottom-up approaches to be ensure that this is part of programming of health systems or primary healthcare programs. What opportunities do exist? Based on my work over the years, it's very clear that suitability of these frameworks, because they align with health systems building blocks, most health actors or health facility managers do like them so much, and it's easy to integrate if you are committed. And then again, like I said, the PHC actors, that's the primary healthcare or health systems actors, actually identify with this concept, especially with the WHO framework. And then tension for change locally. The health facilities are beginning to see this happen. Communities are beginning to miss services because of flooding, because of storms and other things. So you can tell that there is the tension for change locally. And obviously there's an increasing global momentum. It's something that we can leverage on as countries, as health actors, to be able to build climate resilience and environmental sustainability of our health facilities. So what are some of the prerequisites? I already spoke about policy, and if these are not integrated, or if climate considerations are not integrated into policy and health development plans, it's very difficult for you to be able to already get these health actors to do something about it. So we need to begin to see how we can mainstream the health sector, look at interdisciplinary collaborations so that they can begin to appreciate this and mainstream it down into the health system plans and in their community plans as well. And I think that capacity building of health actors is very important, because without the health workforce, you cannot do anything. And I will not limit it to the health workforce alone, other health determining factors, because you can identify that climate change affects different sectors of our society, and it's not necessarily the health sector that controls all this. So we should be able to also build the capacity of health determining sectors to ensure that they are supporting the health systems to really build climate resilient and environmental sustainable health systems. And then again,
d'environnement, et aussi nous avons
what do we need to do?
qu'est-ce que
First
nous
step
devons
for
faire.
me is to integrate
Première
climate
étape
change
pour moi,
adaptation and
c'est être
mitigation
en mesure de
into
pouvoir
health system
intégrer
facility policies.
More exercise.
Hello.
Okay. Come.
Sorry, something's happened.
Yes.
One is
quelque
with,
chose se passe.
I think the interpreter is in the wrong channel.
Yeah, so it's quiet now. I can continue. So first, we need to integrate climate change
Nous
adaptation
devons
mitigation
premièrement
or climate considerations into health systems, facility policies, program of work, and ensure that there are accountability mechanisms, what we call take
ce que nous devons
mainstreaming.
faire à l'instant,
And
c'est...
then again, I think
Et
that
aussi,
what is
je
the cost
pense
of
que
not
quel
acting?
est le coût de nos actions?
We from my first slide, I
Oh,
brought out a number of things that will
j'ai
happen, the
payé
number of people that will die,
prix de certaines choses.
how it will affect poverty and other things. And then I asked the question, are African health systems able to respond to the changing climate? And these 250,000 additional deaths, where are they likely to come from? I think Charles already told us that we are the most vulnerable, so it's clear. This 100 million people that I will reverse back to poverty, where are they likely to come from? Majority of them obviously will be coming from Africa. And then again, universal health coverage. We would not be able to attain universal health coverage if we do not build the climate resilience and environmental sustainability of our health facilities. So I would end my presentation by still repeating who will likely bear the cost, bear the highest proportion of the burden of climate change. Obviously, my guess is that Africa will be one of them for certain. So it is a reason why we need to build climate resilience and environmental sustainability. And I think that we also have to begin to look more critically on the keys and investment keys for this that are suitable to our localities or to our countries or in Africa. Thank you very much. Hello? Can you hear me? Thank you. I'm done with my presentation.
Yes.
I'll hand over to the next year.
Okay, thank you very, very much. And Dr. Rudolph, and yeah, just apologies for just that small hitch between us and the translator, but it's the first one that's happening, and so we ask that you bear with us. So just touching very briefly on what Dr. Rudolph talked about, it's really looking very much on, I think the last statement, if we can move backwards, it's to look at who will likely bear the highest proportion of the burden. And I think for me, that is why I'm here, is to work. So my background is nursing. And so when we talk about being at the forefront, this is where we see on a day-to-day basis, just like our two doctors just talked about, the issues that our patients face. And ultimately, we are also part of those patients and those clients, because when our healthcare systems are not resilient, then we too, as a healthcare providers, are very much at risk. So a big thank you to you, Dr. Rudolph, and we'll get back to you. There are some very interesting questions on chat that are coming in. So if you are able to access those, that'll be nice, so that you have an idea of what is being asked by our audience. So yeah, thank you very much. Now, I'm going to move on to Gerard, and as fate may have it, I'm very successfully losing the bios. So Tinashe, are you able to help me with the bio of Dr. Gerard? I have lost it, but I'm trying to find it.
Yes, just 1 second. Thank you. Congrats.
I think, yeah.
We can put in the chat.
All right, I'm there. So, as the Director of Architecture at Build Health International, Gerard Georges has nearly 30 years of experience in healthcare planning, design, and project management. including for University of Global Health Equity, that is UGHE in Rwanda. The 150-bed ENGA Provincial Hospital in Papua New Guinea, and the BSL-3 Clinical Reference Lab in Haiti. He has worked on several research and healthcare projects for Duke University Medical Center, Partners Healthcare, Mount Sinai Hospital, South Coast Hospitals Group, Massachusetts General Hospital, Merit Healthcare, Cape Cod, and a pediatric specialty clinic at Yale. Gerard studied and taught at the Boston Architectural College, and he has published healthcare articles in Healthcare Design Magazine and Becker's ASC. So, Gerard, feel very welcome, and I am excited about the architectural approach on this conversation.
Thank you. Can you hear me?
Yes, very
Yes,
well.
okay. I am going to share my screen. Just give me 1 second. And just would like to confirm that you are able to see my screen.
Yes, thank you.
Okay. Great. Yeah, thank you. It was really inspiring to hear the previous speakers. Such a wealth of knowledge. I think we could spend a whole day speaking about this. I am going to present the notion of building climate resilient and environmentally sustainable health facilities in Africa through the work that Build Health International is doing or has done in Haiti and in multiple countries in Africa. So all of the images that you'll see are projects that we've completed, and we'll use those as case studies to visualize some of the concepts that I'll present. The image you see here is IGH Genomics Research Laboratory in Ide, Nigeria. So trying to advance, it's not advancing. Okay, here we go. So I wanted to reframe the notion of resiliency and sustainability by this quote that inspires and supports the mission at Build Health International. It's from the late Dr. Paul Farmer, who started Partners in Health. And it's the idea that some lives matter less is the root of all that is wrong with the world. And I believe that climate resiliency and sustainability strategies are all referenced to the singular person. And that's why this is so important to us. About BHI, our mission is to improve access to and build capacity for dignified, affordable, and high-quality healthcare environments in infrastructure and resource-constrained environments. Our first project started in 2010. It's the Hôpital Université de Mirebalais in Haiti. And we have over 250 projects in over 70 countries in Africa, South America, and the Caribbean. What we do is we do architecture planning, engineering for hospitals and clinics. We do project management, purchasing, procurement, oxygen and biomedical maintenance, training and delivery, as well as hiring, training, and equip local workforces. And I wanted to bring this slide up because this ties back to the One Health notion that you heard previously, is that there's a systematic approach to healthcare delivery, healthcare resiliency, and healthcare infrastructure that has to be considered. It's not a singular or siloed approach. So back to basics. Sorry, why is my slide not? There it is. I just wanted to quickly go over the definition from Oxford English Dictionary of resiliency and sustainability, because I think they're very important to this conversation. Resiliency, as they describe it or specify, is the capacity to recover quickly from difficulties. It's really about toughness. Sustainability, though, is the ability to be maintained at a certain rate or level, avoidance of the depletion of natural resources in order to maintain an ecological balance. So we use this as a baseline for all of the projects that we work on because of budgetary concerns, availability of material, and resource challenges that we find. Sorry, my computer keeps acting up. While sustainability looks at how current generations can meet their needs without compromising that ability for future generations, resiliency really considers a system's ability to prepare for threats, to absorb impacts, and to recover and adapt after disruptive events. So what does that mean? We have 4 pillars or factors for consideration. And within those factors, there are a subset of parameters or priorities that we believe are extremely important to address these issues that we're all facing, specifically in the continent of Africa. The first pillar focuses around community. And within the community, there's the context of that community. There is the culture of the community to take into consideration. There's really the notion of security and safety, and then the experience that one has going through, accessing, and interacting with healthcare facilities. How do we strengthen all of those, and how do we make them resilient for future caregivers as well as people who need to use a facility? We're also looking at a pillar that's focused around the environment, the climate considerations as we design, renovate, or add. What is the localized weather, the microclimates that we have to deal with, and how do we design or address that from a person's home all the way to the facility? What is the ecology? How can we minimize disruption to that ecology and then use biodiversity to strengthen the ecology? The third pillar is really around resources. As we know, many locations don't have reliable grid power. So how do we consider renewable sources of energy? Where is our water coming from? How do we make sure that it's clean, safe, accessible, and there's a way of preserving it for future use when issues occur? What are the local materials? What type of reference points that we use to minimize our carbon footprint as we look at the building blocks of the facilities that we're designing, developing, and renovating? And then everything has a waste stream. How does that waste stream get managed in a manner that minimizes the carbon footprint, minimizes the impact of the overall environment in the communities that we deal with? And then the last pillar is really around the focus of this conversation. It's around health. And we categorize them in these manners, and I'm sure there's other aspects that I may not get to, but the first one is around prevention. There are strategies that we could employ to use preventative measures to minimize or mitigate conditions that will require people to come to health facilities, thereby reducing the amount of physical space and energy consumption that's being used. What are mitigating measures that we could apply, or the ministries of health or the caregivers can do to also augment that? Education is extremely bilateral component of health. Without education, you're repeating issues over and over again. And then how do you develop a system or a strategy that provides a consistency so that you can then plan for unplanned events? And then ultimately, it's all around the notion of flexibility and adaptability. So we consider, and again, this is going to be at a high level, and these are projects that we've used to employ some of these strategies. Planning and design strategies are all around risk management and risk mitigation. Where are the known risks that we've dealt with, and what are the future risks that we may have to consider based on climate change and population changes due to climate change? How do we think about long-term growth projections for clinical services that may be needed because of the environmental changes that our populations are dealing with? Planning for that is going to be extremely important. What are the long-term development and zoning plans for a healthcare facility? We want to make sure that the land is used properly to, again, minimize the footprint, preserving the ecology, and be very smart around ways to move forward with future planning. Alternative energy sources, you heard a lot about that, from solar to biogas and other aspects. We look at multiple areas for minimizing the energy consumption that's coming from the grid. Stormwater management is extremely important. As you know, many places have dry seasons and wet seasons. Flooding occurs, which brings on a host of problems. So how do we manage the flow of water through the sites and the adjacent areas? The community should not be impacted by how we manage our water that flows through the site. The other aspect is what we call defensive planning. How do we create spaces, think about ways of addressing mass trauma conditions or mass infection conditions? Then what are the environmental responsive planning that we could put in place to really strengthen our surrounding community? Redundant systems are important, and minimizing large, complex HVAC systems or other infrastructure systems, but having redundancy that could be maintained and repaired very quickly. Incorporating biophilic designs, we all know that there's a natural connection to our environment from a human perspective for the patients as well as for the caregivers. Not only that, but biophilic design supports the notion of natural ventilation, cleaning the environment through the use of plants. Waste management can be handled through natural strategies like digestion, biogas. Consider minimizing long runs for waste and then community waste. And then finally, it's about the supply chain. What are the options associated with mitigating measures to ensure that the clinical environment continues to function during challenging times? And then we think about what we call application strategies. So from those other design strategies, what are the tactical ways that we can approach our work? As I mentioned, we use solar PVs. The hospital in Mirebalais, Haiti, has the largest solar array of any hospital in the Caribbean. We have over 2,800 panels right now, and it fully supplies power for the hospital, which is a 300-bed hospital. It also has a biosafety level 3 laboratory, as well as the National Reference Laboratory. So it's a pretty robust facility, and it's all run on solar PV. The genomics laboratory that you saw in Nigeria, and I'll show you some photos, also runs 100% on solar PV. There are things that we can do, such as solar hot water or point of use systems to, again, provide redundancy. And then we look at things like a biodigester waste system for toilet waste that is a natural way of letting effluents go back into the ground. Biogas production is a byproduct of a biodigester. So instead of buying propane or other types of what I would call dirty gas systems, we can look at a biogas that could be localized for reuse in the facility. Again, reducing the reliance on the grid or other systems that could be impacted in for additional resiliency. Medical waste sterilization. Many hospitals burn their waste now, and it's a really bad habit, and it's really bad for the environment as well as the communities. They shouldn't suffer from that. But things like a medical waste sterilizer could be employed, and that provides a way of reducing the waste that could be thrown back into the environment without harm. We employ rainwater harvesting. These are not new ideas, but they're tried and true for fire protection, for landscape irrigation, for gray water use throughout. Another aspect of the biophilic design is micro farming. Can a hospital facility or a healthcare facility have an opportunity to use micro farming on their property to provide food for the healthcare environment, as well as for local communities, and hire people to do that? So there's an economic opportunity there as well. Using technology such as drones for doing surveys and assessing conditions and changes over time to address any kind of mitigation measures. Using laser capture to scan buildings very quickly, minimizing the use of human resources and capital to do that. There's AI that can help be predictive indicators of where structural challenges can happen on the building. So all of these are tools that we consider for what I call application strategies. And then additionally, there's the data logger to track your electrical use. And then ultimately, it's making sure that we have a system and approach to biomedical training for repair, so that we're not buying new equipment and we're not waiting for someone to come from a major hub to come and repair the work. Having localized biomedical training is extremely important. Let's go on to the next one. Again, through these case studies of projects that we've done, I want to just highlight some of the strategies
Excuse
that.
me, Jaha, can you finish in 2 minutes because we still have another speaker? Thank
Okay,
you.
2 minutes. I'm flying through this in. So climate resilient design solutions in Nigeria. This is located in Ede, which is very north portion of Nigeria. There's a very heavy rain season. So we design strategies such as the roof overhangs that provide solar shading, as well as rainwater capture and mitigation. The roof is strengthened to support the solar panels. We use thick fins to minimize solar gain into the building. Again, I'm going to have to flip through this very quickly. Using large overhangs, as I've mentioned again, to create solar shading, looking at large windows but narrow for daylight capture, and providing courtyards to, again, use the biophilic design to cool down spaces. I'm going to flip through these because if I only have 2 minutes. But it's really important as healthcare facilities, use a lot of energy, as I mentioned before, to find ways of creating outdoor walkable spaces for connections between functional spaces. So instead of having an enclosed corridor, we look at ways of doing that, look at ways of creating communal spaces that are not conditioned, but using a lot of natural ventilation and ceiling fans. I'm going to jump over to the Maternal Health Center of Excellence, which is a hospital project in Sierra Leone. It is a 240-bed facility that we looked at using some of these strategies to address infection control by using natural ventilation in outdoor courtyards, outdoor walkways. The internal planning is such that we are minimizing the staff resources by providing direct views to many of the patient areas. We are also looking at how do we maintain cooling and borrowed sunlight without direct light by the design itself. So we've employed low louvers with operable windows as needed, ceiling fans, and allow the natural stack effect to bring in cool air and vent it out through the roof. So these have been successfully used in Haiti, and we're applying it here. Long overhangs, outdoor walkways. These things also help build a sense of community. They're very simple solutions to repair and provide a sense of pride and comfort for the patients and for the people who work there. These are examples of the interior spaces. Again, the redundancy of using ceiling fans, air conditioning where needed, and natural ventilation all helps support those notions that I spoke. Outdoor waiting areas to help build community within the caregiver space. And then creating small moments where the moms, the children can participate in outdoor spaces for planting. They have a nursery there that they will use to plant throughout the facility. And all of this is in support of the local community. So our construction team is 60% female, all from the local area in Sierra Leone. So I skipped through a few things, but I can address any questions later on. Thank you.
All right. Thank you so much, Gerard, for a great presentation. And we do look forward to catching more of what you have, because for sure there was more. And whatever you have to offer is so important, because so the two past speakers are very, very important, but we're talking about being in facilities. And so knowing how to have the resilient buildings and the green buildings and the green systems, for me, let me use green for lack of a better word right now, is so important. So because of time, I will move on to our next speaker, Aziza. And let me just share. I just shared her bio. I will not read it just because of time.
And I'll just go ahead and invite you, Aziza, to just come on board and share with us. Karibu sana.
Hi, good afternoon, everyone. I think it's afternoon where most people are. Yeah, so I'm the coordinator for Global Green Healthy Hospitals. And I'm gonna talk more about it. I'm the coordinator for Africa. It's a program of healthcare without harm based at Groundwork, and Groundwork is also Friends of the Earth South Africa. So I'm going to just skip over the context, the regional context. I think that everyone knows here about climate change affecting the social and environmental determinants of health and affecting millions of people worldwide, and that the healthcare is not prepared and ill prepared as well in most cases. This is a photo in Beaufort West of a drought that happened in 2018. And in that same year, not very far from Beaufort West, like less than 600 kilometers, this was George in the Western Cape as well. So one place was flooding and one place had a drought all within the same year. And we've seen the devastation of the climate impacts. A lot of times hospitals had to relocate patients. So the hospital system is also affected as much as we're talking about how the health system does contribute to climate change. They also have to be prepared for, in resilience and adaptation as well. So GGHH, what we call GGHH, is a Global Green Healthy Hospitals, is an international network of hospitals, healthcare facilities, health systems, and health organizations that are dedicated to reducing the environmental footprint and promoting public and environmental health. We have over 2,000 members in over 80 countries, and membership keeps growing about health sector to foster a healthy, sustainable future. So beyond our Global Green Healthy Hospitals program, we look at working with governments, advocating for policy changes for climate and health at international forums, and look at government bodies like such as the G20 as well. We advocate for healthcare and climate to build movements and to look at for climate commitments from health facilities. Sorry for the interpreters. I just realized I was talking too fast. It's because of time. And it's been quite a long day. So just let me know if I need to slow down. We're also part of the Climate Learning Initiative that we have guidance on climate action, collection of case studies featuring health organizations on looking at innovative solutions around the world. And this is a community of practice because a lot of healthcare's mitigation efforts are pretty, well, not new to healthcare without harm, but pretty new for it to be mainstream, such as energy efficiency. We work on different projects on a national basis, but also on localized. We have a healthcare climate challenge that makes healthcare institutions commit to climate action and build collective impact. We are also the partner for Race to Zero, which is UN backed. So we do have a lot of Race to Zero members. Rudolph did project our 10 goals for global green healthy hospitals. And these are usually the low hanging fruit. So if you're in a health facility or health organization, we know that you can't move forward without buy-in from leadership to prioritize environmental health as a strategic imperative. And we look at various things that I'm going to maybe just spotlight a few of our members' examples with waste, energy, and water specifically. Gerard George just spoke about buildings and how buildings can be constructed. And I'm glad you also mentioned things like medical waste. So I'm not going to go into too much detail there. So basically, we have baseline assessments where you could measure where you are, because sometimes health facilities that have not committed to climate action are probably already doing things sustainably. So it's good to measure where hospitals are starting. We look at stuff like benchmarking, looking at exchanges and site visits. We expect our members to write case studies on their work, so the initiatives, and we have a climate impact checkup tool that I'm going to speak about in a bit, and then just these guidance documents as well. So the climate impact checkup tool helps calculate your footprint, and it helps you to measure, manage, and support your mitigation goals as well as action planning, no matter where your facility is located. So we kind of made sure that it doesn't have a regional context specific, but we're looking at scope 1, scope 2, and scope 3 emissions. And as the previous speakers have mentioned, scope 3 is where most of your emissions come from. And also scope 3 was also, I think, the hardest to measure for things like business travel and employee commuting, especially in places where there's no public transport. So a lot of times employees have to use their own private cars. So as an example, I'm going to talk about Shifa Al Oman Oncology Hospital in Egypt, where they had high energy consumption, hefty operating costs, and negative environmental impacts. And most of the electricity also comes from fossil fuels, the same as in South Africa. And they've managed over a period from October to March the next year to reduce over 261 tons of carbon dioxide equivalent just by tweaking their HVAC systems. And this is not even moving towards renewable energy. It's just looking at the engineering of what the electricity and the efficiency is. So we have other members that have looked at renewable energy and rooftop solar, and also wind energy in places that are quite windy as well, such as Cape Town. So because the windy parts are usually by the solar areas, those hospitals are encouraged to move towards wind. Then there's also water management. So Cape Town in 2018 was coming towards day zero. They called it day zero, like in the city will run out of water. So during that time, they were constructing the District 6 clinic in Cape Town. And then while they were constructing, they realized that they need to just have rainwater harvesting, because if we're going to head towards day zero, we need to make sure we are ready and prepared for when there's no water in any case. So they reduced their reliance on municipal water and built water resilience amidst an intense drought. And they actually managed to save water and costs. So the rainwater harvesting actually gave them quite a bit of usable water. It unfortunately only did 21% of the facility's total water consumption, but it kind of gives you an idea of what a clinic needs in general. And that was quite important about that study. And then regarding medical waste, we spoke about shredding. I think Gerard spoke about the shredding technologies. We have looked into on-site. So previously, most of the time, healthcare risk waste is incinerated, and that incineration is usually, incinerators are not, they don't meet the minimum emission standards usually, and they're not compliant. And service providers also transport the waste very far. For example, like George Hospital, the waste was going for over 600 kilometers of the waste had to travel. And then they installed an on-site waste disposal, and basically 99% of their carbon footprint was reduced. 70% of the waste volume was reduced. So they've moved away from the long transportation routes and incineration, because this on-site incinerators are not allowed in South Africa at all. And we also looked at using safer chemicals for these machines for occupational health and safety, because a lot of times very harmful chemicals are used in these hospitals and health facilities. We also had one of our hospitals. This is Polosong Hospitals, and these are environmental health practitioners who work in the hospital. They test the water quality, they test the food, and they look at the ambient air quality inside the hospital. And there's a large scope for environmental health practitioners, but they decided they had space to plant a food garden. And this food garden, they've involved some patients as part of occupational therapy. And also the fresh produce not only supplied the kitchen, but also they helped patients who are HIV positive, who come and fetch their ARVs to have food, because a lot of times patients, suffer from food insecurity as well. So this was quite an impactful story. And I'm going to end there. This is from Netcare, where they've had renewable energy. I think this just summarizes everything everyone spoke about moving towards greener healthcare practices in Africa, but also looking at climate resilience, just as preparedness, but also for the things we need to do. And I'm going to end there because I want to leave space for discussion and questions. Thank you very much.
Thank you so much, Aziza. And it's a multi-pronged thank you that you actually cut short your presentation so that you could allow time for discussions, and also for the presentation at looking at what green hospitals look like. So since this is our first conversation and we've already gone a little bit past time, you'll bear with us. and we have 4 more coming up. Now it's time for just a few questions. We have quite a few questions that came up, and I'm just going to ask a few to our presenters. And here it comes. So the first one will go to, is Dr. Charles still here?
No, he couldn't be till the end. Sorry. So
Okay,
just
all right. Okay, so to Dr. Rudolph, a few questions, and I'm just going to pick one for you. And I'm going to ask, when 70% of emissions stem from imported supply chains, medicines, devices, construction, how can African health systems with finite budgets claim sovereignty over procurement decisions that are largely dictated in Geneva and Washington?
Yeah, thank you. That's a very difficult and challenging question. I'll try to answer it, and then I hope that others can also join in. But I think that it boils down to leadership and then choices. And then, like I said, if we do have a health facility, it's not everything you can do at a go. Considering the historical perspective, maybe some of these things are beyond your control, but there are things we can do. How do we procure in bulk? Are we dealing with things that can be gotten locally? Again, when it comes to the issue of vaccines, I believe there's a big initiative to vaccine production in Africa. So can we begin to look at some of these things so that we can at least cut down on the cost of transportation? So that's one thing. And then I must emphasize that I see this whole business as a highway. There are people with very fast moving cars and there are people with very slow cars, but we all have to get to the destination. So we must bring just transition is important, but we must begin to do things we can do right. And then the low hanging fruits, like Aziza said, let's pick them, why not? And then again, we can begin to see how we can involve everybody, because I see it as a political issue, just like people begin to ask for roads and clinics and hospitals. Can we also push this out as a political issue? And can we also take advantage of new investments to make sure that we are mainstreaming and already cutting the cost in the future? Thank you.
May I add to that?
Yes.
I think that's a great answer, and it's a challenging problem. One suggestion would be, is there a way of collaborating with multiple countries on biomedical training and education for all of the systems that need to be supported in the healthcare environment? I think that would be one way of minimizing your waste stream, your supply chain, and localizing the efforts.
Yeah.
Awesome. Thank you very much. So I'll just skip. And I think one of the things that we're hoping that we can do just real quick is that some of these, we can touch on them a little bit more, and we can also work on a platform where the conversations can continue, because that's the ultimate goal. So for you, Gerard, one of the questions, I think you answered this one actually. So it was about the new construction. Are these new constructions, and is there public costing of this work available? But I just wanted to maybe connect it to that one. We can touch on something else that you, Gerard, and the others can also look into. Given the pressure on treasuries to procure at the lowest upfront cost, how can life cycle costing for green alternatives, that is solar, cold chain, reusable devices, be justified as a strategic investment rather than and an affordable luxury in under-resourced systems?
Hmm.
Uh,
That's also a challenging question because it's all data driven and metrics based. And because of the localized communities that we work in, there are variables that need to be taken into account. So it's really starting off with getting a good set of data parameters and using that to evaluate the results over time to then be able to justify the funding that would be needed to support those efforts. We have a lot of anecdotal information, but the data is really important to collect.
Thank you.
Yeah.
Rudolph, Aziza?
Yes, I agree with Gerard. I think that it is one of the areas we need to research because policymakers actually, the cost is a big problem. And you can only convince them when you are able to demonstrate cost savings in the long run. So I think that is one area we must look at very critically as researchers and practitioners, build a database over time, and then we can easily see it. But again, like I insist, I showed a slide of a beautiful built rural health facility that was built in a marshland. So when it rains, the health workers cannot come out. The communities cannot get to the facility. That's really a wasted investment. They are going to obviously abandon that. So I think that we need to do more there, but I think that there is a lot of information around that we can gather. It's just that we have not taken the pain to do that, because in one calendar year, there might be a number of extreme climate events. We see the destruction. Some of them never get constructed. Some of them don't get to recover appropriately. I think these are things that we can build on over time and deal with.
Yeah, I think we could also, health professionals should become advocates for climate in a way that you can also reduce your carbon footprint as a hospital by strengthening primary healthcare services, because avoiding a patient getting to a hospital so that primary healthcare has taken care of them already reduces your carbon footprint. And just beyond that, talking about money and resources, I think advocating just for moving away from fossil fuels in general, looking at things like just transition, unlocking just transition funding is important. And also looking at for health, because when we also look at things like loss and damage, a lot of times pollution affects health. And there's not, sometimes corporate responsibility is also shirked when it comes to health. And there's also a lot of greenwashing and false solutions that we should also look at. Because sometimes when we look at air pollution, we think about what's in the household and things like burning. And I saw that there are lots of times that they're not, like, for example, incinerators, health facilities don't even have incinerators. Someone said in Somalia, they just burn the waste. So I think those type of interventions of like taking that waste away to be treated, because that's actually an environmental hazard, but also a hazard to the community that's living in that environment, from maybe having syringe, needle stick injuries, but also the air pollution. So there's a national advocacy, and also just advocating and looking at best practices is important. So demonstrating long-term savings would probably, sometimes people don't listen when you say people are dying, but they do listen when you say you need to save money. So perhaps that could also work best.
Yeah, thank you so much for that input. And I think I just want to say real quick that I know there was somebody who said that these issues we're discussing, they don't just affect us in Africa, it's global, and it's very true. But our conversation is quite focused on Africa for now, but we know that if Africa is doing better, then the globe is happier and it's better. So the context, the location where we construct these hospitals and these facilities is also so important. And as we get the donations that we get sometimes, it's not just implementing what we're told to implement. It's saying, we'll do this or we won't. The last one, And this for you, Aziza, but all of you. So in contexts where ministries of health are often absent from national climate governance, what mechanisms are needed to ensure health sector carbon accounting is not sidelined, but integrated into climate bills and acts and NAPs and fiscal planning, especially when every resource is finite?
Yeah, this one is quite difficult. I mean, when we work, our work with most ministries of health depends on the resources they already have. Um, so looking at how to convince them to get to the table is also connecting the Department of Environmental Affairs, because a lot of times in our ministries, health has never been part of the COP process, for example. But health, because there's a health day now, and we're pushing for a Minister of Health to sign on South Africa, and also programs like WHO's Attach program would also help ministries and give them the technical assistance and guidance to work through what they need to do, and also probably unlock more funding so that they could also apply for funding by themselves. And the problem with finite resources is that our health systems have other priorities. Some health systems don't even have medication, and they're like, why do we need to think about sustainability when we don't even have enough asthma pumps? But if you think about those asthma pumps that you need it because of the pollution. So that is the type of things we actually tell our health system, like, you will spend less on asthma pumps if the PM 2.5 levels are okay. So if we have that policy driven resource, and also for resource allocation to happen, we need to show that this is a priority. And we won't show that it's a priority if we haven't displayed the smaller acts, the smaller little pilot projects. So those pilot projects are very important.
Thank you, Aziza. Rudolph, you want to
Yes.
come?
Can I?
Yes, please.
Can you hear me?
Perfectly well.
Hello? Can you hear me now?
Yeah, we can hear you.
Yes, I think that the momentum is gathering, and then I think that I've yet to visit any community and then find out what they will need immediately, and you don't find a health facility as number one or number two priority. Maybe health facility or water system and the rest. So I think that there's much more support for health. Possibly the ministries of health have not utilized to potential the level of influence they can have on decisions. And
Well, we just lost Dr. Rudolph. Okay, Rudolph, come in. I think you're muted, Rudolph.
So what I'm trying to say is that the health sector has enormous influence and support, but we are not taking advantage of it. And then it boils down to the way we work. We work in silos, like we had seen earlier on. So I believe that the first step is the health sector itself to try to get into play, get involved. And that will be the beginning, whether it's at the local government level, it's at the national level. I think that momentum is on our side, and we could get that transdisciplinary support to get this done somehow.
So I want to thank everybody, and to say that for further engagements, questions, and feedback, there is an email that we have shared in chat. If you can, feel free to get back with us so that we can do this better, share our ideas, because it's our health and well-being we're talking about. So I'm going to close very unceremoniously, but thank you so much to our presenters today and to our audience, and much, much more to come. Thank you, and be well.